viewers, welcome back to my YouTube channel, and on today's video we're going to talk about the first stage of labor, and we are going to talk about what really happens in this stage, so that when you are in this stage you can understand better. And also in my previous video I talked about advice to birth assistant. This advice to birth assistant is related to this first stage of labor, so you can go watch it and relate with this. So without any further ado, let us begin our video. So during this stage the cervix opens out. That means it dilates to allow the baby's head to pass through. So before it dilates, the cervix becomes thinned and softened and is gradually pulled up by the contracting uterine muscles, and this is called effacement. So the muscle of the upper segment of the uterus contracts and puts pressure on the lower segment, which in turn transmits the pull of the contractions to the cervix. As a result, once the cervix has stretched, it dilates with each contraction until the entire cervical is eliminated. And this means that you are then fully dilated. And note that the degrees of dilation of the cervix have been standardized so that it can be described accurately and progress can be charted. And this is all over the world. The centimeters are the same. So the readings are always the same. So what you need to ask the midwife is how labor is progressing, and she will probably respond in terms of the number of centimeters of cervical dilation. So the main question when you are there with your midwife, with the midwife during the first stage of labor, you need to ask the midwife. You need to ask her how the labor is progressing, and she will probably respond in terms of the number of centimeters of cervical dilation. So dilation is normally given in 1 centimeter increments up to 4 centimeters. So at 5 or 6 centimeters the cervix is described as dilated. So in case if you are in that you are in the first stage of labor and you are told that you are at 5 or maybe at 6 centimeters, just know that you have dilated. And when the cervix is said to be fully dilated, it is approximately 10 centimeters in diameter. So if you are told you are at 10 centimeters, know that you have fully dilated. Yes, you have fully dilated. So, and this is the completion of the first stage of labor. So if you are 10 centimeters dilated, know that this is the completion. You have finished the first stage of labor, though in real terms the first stage often moves gradually and smoothly into the second stage without punctuation. Without even you noticing, you will be already in the second stage of labor. So when you are in this stage, the fetal heart will be regularly monitored. Yes, it will be regularly monitored, and internal examinations will be done every 4 hours to check progress. Yes, every 4 hours internal examinations will be done to check progress. So ask the midwife or get your partner to ask her if you don't understand any question. Please ask, be open, ask in case you don't understand something. So if you feel that your contractions are getting longer and stronger, and you haven't had an examination for a while, ask for one. Yes, sometimes you might find that the room is full. Yeah, there are a lot of patients, mothers to attend. So in case the contractions get stronger, please ask, don't just be quiet. Yes, you might be forgotten because of the way the room is busy. So please ask for examination. Yeah, you might be already in the second stage of labor. So please ask and don't be quiet. And also, it is quite cheering to find that your cervical dilation has progressed through. And people who haven't, people who have nothing to do with your birth will be coming into the room all the time, and so make sure that your companion stays. Please make sure that your companion stays. People will come. Yeah, you know, people will come who knows you. Here, please, just in case of uh, any trust issues, please make sure your companion uh, stays. Yes, and it will also help to attend them. Yeah, and it will be there therefore for you. Also, you may be asked questions during an internal examination or while you are having a contraction. So concentrate on what you are doing and answer question when the contraction is over. So when they maybe you asked questions and you're in the middle of contraction, remember here the contraction is the main part, because this will help you in giving birth. So please concentrate with the contraction and answer these questions later. These questions are going nowhere. Please concentrate on the contraction. Yeah, and as we are winding up, let us talk about positions that are safe, are okay for the first stage of labor, that help in the first stage of labor. So you need to stay upright. This encourages contractions during the first stage. Please stay upright. Stay upright. This encourages contractions during the first stage of labor. And also, you need to stop what you are doing during the contraction and support yourself on whatever is close by. Yes, if you notice that you are in the first stage of labor, please stop what you are doing during the contraction and support yourself on whatever is close by. Yeah, and also, if you have a bucket, kneel down on all fours and rock backwards. Kneel down. In case you have a backache, please kneel down on all fours and rock backwards and forward during contractions. Yeah, don't make your pain worse. Yes, don't strain your back in case you already have a backache. You can kneel down, yes, on all fours, and this will be of help helpful. Yeah, it will help a lot. And also, as I'm finishing, uh lean on your birth assistant. Yeah, if you are there with your birth assistant, please kneel on to your birth assistant. Yeah, the weight of the baby will be taken off your spine, and the contractions will be most efficient in this upright position. Yeah, in case, yeah, you can also, you can also lean on to your birth assistant, because yeah, the weight of the baby will be taken off your spine, and the weight of the baby, will be taken off the spine, and the contractions will be most efficient in this upright position. Yes, also you can uh also he can massage your back. He can help by massaging your back. And for that, we have come to the end of our today's video. Please, to my returning subscribers, I want to thank you so much. Please continue watching, and for the ones who have not subscribed yet, please subscribe to that subscriber button, so that you get notified anytime I upload a new video. Don't forget to like, to comment, and to share. Yes, thank you so much, and see you in the next video.